Hey there and welcome back. Today we'll continue talking about the AO classification of pelvic ring injuries. For proper memorization and usage of this classification, keep in mind 2 points: posterior arch integrity and hemipelvis displacement. Now for posterior arch integrity, it can be intact, partially or fully disrupted, unilateral or bilateral. And for hemipelvis displacement, it can be externally rotated, internally rotated, and vertically displaced. Moving on to type C, which is vertically and rotationally unstable. So one can conclude that the posterior arch is completely disrupted. The disruption can be unilateral in C1, bilateral in C3, complete disruption in one side and incomplete on the opposite side, which is in C2. Now for the hemipelvis displacement, in C1 there will be a unilateral vertical displacement. In C3 there will be a bilateral vertical displacement. And in C2 there will be an ipsilateral vertical and contralateral internal or external rotation. And finally, remember, it's all about the posterior arch and hemipelvis displacement. That's it for today, and as always, thanks for watching. Till next time.